to begin tonight's meeting by reading a very brief script just to introduce the fact that this meeting is being conducted remotely in response to the ongoing pandemic, COVID-19 pandemic. This is in accordance with Governor Baker's executive order of March 12th, 2020. And in order to mitigate the transmission of the COVID-19 virus, all public gatherings have been suspended. So consequently, since this meeting is now being conducted remotely, public access is provided via phone and Zoom. We do intend to take public participation if people wish to speak. Typically, we do it after the board has introduced a agenda topic and the board members have had a chance to discuss it. We usually offer an opportunity for public comment before taking a vote. However, like I say, that's an intention. Hopefully we'll be able to stick to that. And other than that, just as a note, please be aware of the fact the meeting is being recorded on Zoom. And if you do wish to speak, please identify yourself and where you live, and wait to be recognized by the moderator, which is Ms. Ball. So thank you very much. In that case, Cheryl, would you mind, I believe you're first on the agenda anyway, but would you mind introducing the agenda items?
Yeah, so good evening, everybody. I have a few concerns I'd like to discuss with the board before we start. One being we're continuing to get complaints from the skate park. One particular complaint this morning stated that they were at the skate park and there was 25 youngsters there, and that none of them had a face covering on. So I would like to discuss next steps with the board regarding the skate park. Do you want me to move forward, or do you want to discuss that first?
Oh, that's fine. Let's discuss it. So I believe that was actually a topic at the joint meeting we had with the selectmen, that was an area of concern. And I believe the consensus opinion of both boards was that if, we didn't see, changes in approach, that it would be necessary to close the skate park. So I assume there's adequate signage and notice posted?
There is, and as well as a container of face coverings for people to wear. So there's really no excuse not to have one on. And I know the police periodically have checked it, and they also have passed them out in the past, but it just seems to me that it's gone to the next step, and I would recommend closure if that's the board's pleasure.
Okay. Just the last question, you said you got a report of up to 25 people without masks. Is what the reliability of the reporter? Is it someone from town government, someone you know?
No, that was just the complaint that it was not verified. No, that was the complaint that it was the enough of the complaint since we discussed this at last week that I felt the need to bring it up and to go the next step. It's not the only complaint, so I believe that these complaints are verified.
Okay. So my suggestion, and it's just a suggestion in the to be the most fair, is I would suggest we ask that someone from town verify the behavior at the skate park, police department, health department, recreation department. Just someone who has a town ID card.
Okay.
And if it's verified, then my recommendation would be, yeah, we should close it. And my also suggestion would be it should be closed with notice that it was due to the fact that people weren't complying with the mask mandate, and that, we'll reconsider opening it when we feel there'll be improved compliance, if that's possible to do. So, members, comments?
Yeah, I think at this point it's really hearsay, unless somebody official, as we suggested, sees it. The park isn't that big. I would find it a little hard to believe there were 25 people participating at the same time. So I think observation is in order before anything else is done.
Okay. If the observation is confirmed, Dr. Jacoby, would you agree with the conclusion?
Yeah, except, I mean, if there's 3 or 4 kids without it, then that's not the same as everybody. I think everybody is a little hyperbole. I would not everybody. But yes, if it is everybody, sure.
Okay, thank you. Other members? You know, if you don't object, you're Mr. Martin. Actually, Mr. Martin, would you mind? I think Dr. Singh actually was looking to say something before you raised your hand.
Oh, please.
No, actually, I was just saying that, like, as soon as Cheryl gets the complaint, can she call policemen and ask them to go and check? Is it possible? Or
I can.
yeah, so that should be the perfect way to confirm. And then, if it's like if there are people without masks, then I would agree with closing it.
Thank you. Mr. Martin, please go ahead.
Yeah, I have 2 questions. Cheryl, did you say that the police had seen this? Or you said the police did not see this behavior?
The police have seen it in the past, yes.
Okay. And the second thing is, I don't know whether we need to get people from recreation or whatever, but how effective, what's an effective way of closing the park? Should we need to do that? Is just notices enough? Or I don't know how people get there. You know, my guess is that many people who use the park don't drive there. They might just take their skateboards there. You know, I don't know what's an effective way of closing the park, or whether notices are just enough. Just a question.
Yeah, no, I agree with you. It is a bit complicated, but I did chat with the police today, and they have agreed to send an officer by as they're driving by to check to make sure that if the board did decide to close it, that there was no one there. So they have agreed to help with that. You know, in the past, you know, prior to skate parks being allowed to be used by the state, when it was closed, we were actually town staff witnessed parents dropping kids off with a Jersey barrier blocking the parking lot, and they still were dropping their children off. So it is a difficult task, but one that we'll have to be up on. So, I mean, I agree with the board. You know, we'll make sure that we can verify this complaint.
So I think the board's consensus is that if it's verified, then the appropriate action is to close the park at least temporarily, say like 2 weeks, which should be enough to cause any COVID contamination to dissipate.
All right. So the next concern I have is we have a at the board's direction, I'm now permitting youth sports leagues to utilize fields, which the board had suggested we do that, I think a couple months ago. So I did permit one that's happening this weekend. It's December 4th, 5th, and 6th. And it's a large soccer game. So didn't realize when we were permitting them how large it was. So it actually caused me to make sure I question that for any future ones. But apparently it's this large group that is having soccer games throughout the day on all 3 days. So we questioned them today and we asked them if they were a tournament, because it seems from what we heard that it was more of a tournament play, which is not allowed for soccer in a moderate risk sport, which is what soccer is. So we reached out to them and they told us that they had initially planned it as an annual tournament, but FC Stars is the name of the company, has revised their program for the weekend and it's now just a series of friendly games. Teams only play one game per day, so there is no one hanging around between games, no score or results recorded, and no playoffs or finals. I think the activities on the turf meet the definition of competitions which are allowed under state guidance for soccer. But I wanted to bring this up to you because there has been a complaint to the state about this. They're also looking into it. I just thought it was important since we had a meeting tonight to discuss it with you all. The permit that I grant states that they have to be in compliance with the state guidance for youth in amateur sports. And also it says I have the right to pull their permit. So even though I've already issued a permit, it still could be pullable. But I did do some more research on this organization, and I did see that they are definitely following COVID guidelines. So only 22 teams, 22 players times 4. They've told everybody they have to have a face covering on, they have to social distance. The next team can't approach a bench until the other team is cleared. Spectators have to stay in their car until 5 minutes before kickoff. So it seems like they're on top of the COVID guidelines. So I just wanted to bring it up to see what you all thought.
Okay, thank you, Cheryl. Appreciate it. Members, comments, questions? Cheryl, Mr. Conaby.
Cheryl, is there any further guidance on tournaments from the state as to definition or how they're enforcing this for other sports or other venues in other communities?
I have not seen a definition for a tournament, no.
Yeah, I just quickly did a quick search for it. It said one or more competitions held at a single venue and concentrated in a relatively short time period. That's the definition. Sounds like this meets it. I mean, if we're closing the skate park due to non-compliance and large gatherings, it does seem that this doesn't quite seem an appropriate activity. It sounds like it's skirting the tournament definition, but be interested to hear other folks think.
I would disagree. It's kids on a field, and if they're acting appropriately, I don't see it much different than when the high school kids are out on the field. I'm down there a lot because I walk there, and the teams are there and working out, and everybody has a mask on. I think if these people act responsibly, then I don't see why not. I don't see why they shouldn't be allowed out there.
Thank you, Dr. Jacoby. Ms. Becerra.
Yeah, I agree with Dr. Jacoby. And it seems like, based on what Cheryl said, that the organizers have strict protocols in place. And like she said, it's only, one team playing a game and then they leave. They're not hanging around. So I would feel okay with it based on what she has described.
Okay, thank you, Ms. Becerra. Other comments from members? Okay, well, Cheryl, it sounds like you've given it quite a bit of diligence, and the idea why we were asking you to permit them was for sort of one of the reasons you mentioned, which is, if they fail to follow through on what they claim they're going to do, then we can just tell them that their use of the town field is now not possible. So they have an incentive to make sure that the people that come to play follow the rules. It puts the burden on them rather than on the town, which is what we intended to do. So I guess given that, I think it's, if other members wish to voice an opinion, but I think it sounds like with careful monitoring, we're probably okay with it. I don't see anyone else wishing to make a comment. So,
Cheryl, are they going to disinfect between groups and not have any water breaks on the bench and take care of all those other protocols? Have those been done to your satisfaction?
I did not see that in their guidance, but I can reach out to them to make sure that's included. I may have just missed it as well. It was quite extensive.
Yeah, I mean, if the kids are wearing masks and there's no contact, disinfecting between, no trash or other things, and wearing masks. So the concern is like some of the other contact sports where you can wear a mask part of the time, but when you take off the mask, back at the bench and drink, etc. So making sure those are followed, and obviously it'd be great if there would be some compliance monitoring to make sure that it is being followed.
Okay. All right. So last thing I have, and then we can get on to Heather, is I actually had, I think I mentioned to you before how many businesses we're getting with positive cases. It's happening more and more. It's pretty much constant on a daily basis at this point. So I had my first argumentative owner today. He has a business in Acton. I spoke with his HR on Wednesday. I advised them to close to do a disinfection. They were closed Thursday, Friday for the holiday. So I advised them to call me on Sunday because all the employees were being tested as of on Friday. So I asked her to follow through with me on Sunday. Never heard from them. I called them this morning. The person I spoke with wasn't in, so I spoke with the owner, and he pretty much told me that if I don't have a medical degree, he's not even going to talk to me. So they are a medical supply facility that is deemed as essential. So their guidance is a little bit different, but he wouldn't even talk to me about the guidance. I asked him on 2 occasions if they indeed closed on Wednesday for a deep clean. And on the second time, he finally answered and he said no. They didn't follow any of the protocols that I talked to the HR person about on Wednesday. So, basically he hung up on me when he asked me if I had a medical degree, because he said he only talks to doctors about this. So I'm kind of at a loss. So I had received a couple complaints from families of workers there. And I also received a complaint from the state this morning, from the Department of Labor and Standards. So after the conversation, I reached back out to the state and I said, I need help. I need help. I don't, I'm not sure what to do here. So I figured I'd bring it up with you all tonight to have a discussion, to see which step you want to go. The state has already gotten back to me, so they're sending a supervisor to deal with this. So it seems like it's being worked on, but I have no assurity that the contact people are all working. I'm pretty sure that that's happening. But even the guidance that we have says that there's procedures they have to follow to allow close contact people to work. I have no assurity that any of that's being done either. So I'm really concerned about this one. So I thought I'd bring it up with you all.
Oh boy, can't you give us a couple softballs, Cheryl? So as the board has stated many times, I'll just offer my own opinion. We'll ask for member comment, but the goal is compliance, right? We don't wish to be any more burdensome than we need to be. But this is a serious pandemic. People are dying, and we have standards established by the state. We need people to follow them, and I think as it was one of the governors, I believe it was of Maryland, who just said, what part don't you understand? Follow the guidance, the end, or follow the rules. So I guess my suggestion would be, please closely align with the state. If you need a Board of Health order, I would anticipate the board would probably would entertain it, but perhaps the state will be able to convince them. If they need someone with a medical degree, we have two on the board, we could volunteer, I guess. I don't know if either one would wish to be stuck in that situation, but anyway, other comments from members?
Would you say that they had people who tested positive? Was that the issue?
Correct. Two employees that I know of.
Yeah, that's not good.
Are they interacting with the public? Is it a public business? And you mentioned medical. Are they providing services to residents in off the premises?
No, I don't think public go in. They definitely have a clean room, and they are supplying cranial drills and cranial clamps for neurosurgeons to assist with brain surgery. So I also, when I spoke with the gentleman today, I told him I was going to bring it up with you all tonight, and I offered him the Zoom link to participate, and he declined.
There are state guidelines and requirements for the businesses on the reopening in the state. Do you feel it's necessary to, and with record retention, do you want to check with them to see if that's occurring, or do you want to defer to the state on that?
Well, since he won't talk to me, I'm hoping that the state could, definitely, give him a little nudge. So I'm thinking, let's give the state some time. They got back to me pretty quickly this afternoon after I sent that. So I have all faith that they're going to follow through on that. So I can have a conversation with them tomorrow and see what the plan is, and then go from there.
Sounds good. I think it should also follow up with some written correspondence to them. It would be good to document some of the information, as well as to provide requests that they provide compliance. Sorry about that. Too many Zoom things at once.
Okay, I can do that.
Cheryl, did you say they've tested other employees
They did.
and they haven't given you any results?
No,
How many employees do they have?
I think 24.
This sounds like contact tracing.
Well, yeah, it sounds like it's slightly worse than that, because it sounds like as part of their work, they need to work, within 6 feet of each other. And there's specific guidelines for that as well. I think as we've heard from some folks, and as you've said, Cheryl, I think you're on the right path. I mean, this needs to be resolved. It needs to be resolved satisfactorily. If the state can take the lead, they have more tools and resources available to ensure compliance than perhaps we do. But so if they can take the lead, that would be probably the best.
Okay.
If they can't, for either because they're resource limited or they feel they have other constraints, then I think the board would, like I say, entertain taking action.
Okay. All right, I promise that's all I have. So I know Heather's up next. We have Chris Foy from Life Care joining us as well. So I'm going to slide him over while Heather's talking, just so you know, okay?
All right, that'd be fine. Well, before we transition to Heather, let me just ask members any questions, comments for the health director regarding the updates? Okay.
Nope.
And then Cheryl, or anyone in the public which wishes to make a comment?
No.
Okay, very good. In that case, Heather, please bring us up to speed.
Hi, good evening, everyone. So the numbers in Acton overall cumulatively since the beginning. Today we're at 337 overall. We have 47 in isolation at this point. There's a number that I have not received their positive results through the state reporting system in response to Life Care Center, I put those on the overall number once I get them through the state system. So when the state's doing their reporting and percentages, our numbers are where they should be. And I'll let Chris give you an update further after I finish. The Inn at Robbins Roof benchmark, they have currently 3 positive employees. One of the employees has not been in the building for quite a few weeks, so there was no direct close contacts with residents. They have since tested all the residents, and they all tested negative. They will be doing the test over the next, let me just see. Sorry about that. I didn't write down what I wanted to say. They will be testing the residents periodically until there are no additional, until they're all negative over a greater than 14-day period based on the last testing. So the residents were tested on the 25th and 26th, and they are in contact with their person, their epidemiologist at the state level. So that is benchmark. Life Care Center, as I said, Chris Foy is on, as you can see him. They have had a total of 28 residents. Today is day 11, I believe, since their initial first positive case. There are 15 staff members. It is of note that the first positive within the building were residents, and it was not staff. I did confirm that with Chris, but he will go into further what they're doing on their level, which is a plethora of things like they did in the spring, including having a daily DPH call, working with an epidemiologist directly, have an isolation area, a quarantine area. They've shut down visitors, they've shut down admissions. So all of those good things that they did in the spring are continuing. So I will let him go on with that. Trends right now, still household spread seems to be the biggest piece, or other relatives / friends that are meeting outside of their immediate households. That seems to be the spread lately. I'm a little bit nervous about what Thanksgiving celebrations will bring in the next week to 2 weeks. I actually spoke with a couple of people today who were symptomatic and still went to Thanksgiving on Thursday and then tested positive on the weekend. So I have a lot of concerns about that. And just, everybody's on social media. I've seen so many different photos of people I know that had big group gatherings. So that's definitely a concern on my end. And I know Cheryl's been concerned with that. I think that is probably it for me. I'll turn it over to Chris so he can give you the update on everything that they're doing over at Life Care Center.
Thank you, Heather. Good evening, Mr. Foy.
Can you hear me?
Yes, we can.
Oh, okay. Thank you for letting me speak tonight. So I've been working very closely with Heather on keeping them posted on our status, how things are going with us. I guess as of right now, for the numbers that we have, we do have 28 positive patients. We do have there's 5 people in the hospital that are being treated. We do have a separate COVID isolation unit that has its own specific staff. It meets all the criteria set up by the state for a COVID unit. It's completely separate. It has a separate entrance, a separate exit, separate supplies. It's got a donning and doffing area where you can put on your PPE, take off your PPE. It even has its own break room on the area where staff can stay on that unit so they don't have to leave. And we have a specific staff that takes care of those people. We also have a quarantine unit, so anybody that's under suspect or suspicion of having the coronavirus, we have to keep them on 14 days in another part of the building under a droplet precaution where we wear specific PPE. They have a room by themselves, and we monitor them for 14 days. So as of right now, everything that we have is from one nursing unit. We had a nursing unit of 30 residents, and everybody who's been affected has been through that one unit, and everybody who's in quarantine has been from that unit. And the people we put on quarantine is anyone that could be a potential exposure, or like if their roommate was positive and they were negative, they would be in quarantine for 14 days. So what we're seeing right now is the couple extra positives that we're getting are the people that are on the quarantine unit that have been on that unit within the 14-day period. Right now, we're doing a surveillance testing. We're testing our staff every 3 to 7 days. We're testing the residents internally. The ones on the quarantine unit, we're testing every 3 days. The general resident population in our other 2 units that are negative, we've been testing those every 7 days. We are using the PCR testing through the labs, but if you've just been watching television, the state is so inundated with these tests right now that we're actually, the state has given us other testing methods. We do have these Binex testing cards put out by Abbott, and it's a card system that we can actually test and get a result within 15 minutes of taking it. The PCR test or lab test that we run that goes right through the state, unfortunately, they can take anywhere between 48 to 72 hours. Even right now, because of the run on Thanksgiving, sometimes it's taking even 4 to 5 days just to get a PCR test read. So these local tests that we have that we got from the state are very helpful because we can do it, run it for 15 minutes. It has a very high efficacy rate. I think it's about like 93%. We also have POC antigen testing units that CMS, the government, has given us. So we do have some internal methods to test people that are symptomatic that we can test on the spot. We can test staff if they don't feel well. We can stop. We can quarantine them. We can test them. We're doing these daily. Everything we're doing is very, I guess, above boards and transparent because we are under the Department of Public Health. We do have the daily phone calls with a state epidemiologist, with a state surveillance surveyor who just gets our numbers and we talk to them. I speak with Heather York as needed, send all the numbers that we have to her. I actually got a call today by Jamie Eldridge. We had a very nice chat. He asked me a lot of questions, kind of what are we doing, how are we working with the hospitals, how are we doing internally, and actually he wanted to have a meeting possibly next week, like a Zoom talk, just to kind of talk and see how things are going, if there's any way that he can help, things like that. So it's always that hard part of, kind of the cart before the horse. How did it get in? How did it start? That's the hardest part in tracing is that our first positive test that we had were all residents. But typically it might be a staff member that would be first and the staff member would pass it on. So that's the hard part for us right now, trying to figure out how it actually got into the facility. But as of right now, again, all our physicians are on board. As soon as we did get a positive case, I did reach out directly to Acton Fire, Acton Police to make them aware. We reached out to the EMS dispatch so they were aware. We reached out to the local hospital to let them know. Our attending physician reached out to Dr. Bergen, who's the head of emergency medicine at Emerson Hospital. So we really kind of took a village on this one. As soon as we found out that we had it, we contacted everybody within the community and everybody kind of on the state system so they're aware of it. And right now, it's just surveillance testing. I mean, we are testing every day, staff and residents, with internal testing and with PCR testing. And we have to continue doing our testing until we can go. We have to test the staff every 3 to 7 days until we can go 14 days without a new positive case, which would take an account for the 14-day quarantine for the virus. And that's where we stand presently. And we just continue to work with the state and with the local Acton Public Health.
Okay, thank you, Mr. Fye. Just a simple question: the staff that works exclusively in the COVID positive unit, are they by any chance folks that have already had COVID? I'm just thinking that would, if you had to select staff, that would be a good potential choice.
That's a great question, and the answer is yes. We do have. I have 2 nurses, a therapist, and a CNA who have previously had it. The downside to that the CDC and the state of Massachusetts has stated that anybody that's over 6 months recovered, we still have to test them, and if they are symptomatic, to still test them. We have not had a reinfection of a resident and or a staff member at this point in time, but we do have staff members that are recovered working on that unit, and they feel more comfortable on the unit. They're still wearing all the PPE and all that, but again, there's not much around here about being reinfected at this point in time.
Yeah, I understand the guidance completely, but I'm just thinking their odds are probably better than someone that's never had it. So they, like you said, they might feel more comfortable. Questions for either Director York or Mr.
Yes.
Foy from members? Dr. Taylor.
Yes, I do have a question. Since you mentioned your staff, you have cases in the staff. Have you had trouble keeping the nursing home, manned while these people are quarantined? Is that a problem?
As of right now, no. So in general, with our census, we were a decent sized building. I mean, we're 134. Before the original pandemic, we usually averaged around 126, 128. After our little over 5 months ago, we were averaging around 105.
Okay.
Currently, I have about 85 residents. When we did first go positive, a lot of our short-termers wanted to go home. So we got them prepped, we got them ready, we got them services in the community. And, with the holiday coming and with being COVID positive, there are some people that wanted to go home. So we set those up. So right now, because of the amount of residents we have, our staffing is actually pretty good. We did have some CNAs that did test positive, but we seem to be really well on nurses, and our nurses are willing to work as CNAs right now. So right now we're doing pretty well. And Kate Saunders with the State Epidemiology Office, she's been calling me for the past 3 days. They actually have a rapid response team by the state that has between 8 to 10 direct caregivers that if a facility, as you just mentioned, is unable to staff themselves correctly, they can come in within a 24-hour notice, come in and stay at your facility for 3 to 5 days. And they can work on the COVID unit, or they can work on the quarantine unit or the negative unit, wherever you need them. And they're all fully educated in full PPE, infection control measures. So she's been calling me. We haven't needed it. There's a new PPD that was actually, it's called like a person per day, like hours, that Department of Public Health came out with, that we need to run a minimum of it's a number called 3.58. And we've been running, even with COVID, about 3.7. And it's kind of a ratio of staff to residents. So right now we're doing pretty good with it, and we've been able to shift people around in the facility to make it better, kind of more staffing. We kind of evened off the units where we could to make it more evenly balanced. So we're not like heavy staff on this side and lighter on that side. So right now we're doing pretty good with it. And we are looking, there's probably about 3 staff members that should be returning. I believe one is being cleared Friday, or 1 is Thursday and 2 Friday, 1 nurse and 2 CNAs from their public health, from their town, from their public health department.
Excellent. I'm glad things are working well, because that's one of the risks with a good size outbreak. As you lose your staff, it makes it more difficult.
And the staff, they actually feel pretty good about the testing. I mean, we used to have the swabs, and we used to have the swabs that I felt like they would tickle your brain, and we'd have to get tested every week. We now have the swabs that can it's a softer swab that can just do the inside of your nostril, and now the staff is they're not as hesitant to get it, because we used to have to go up pretty high before.
Yes.
But even with the new testing things, and they're really seeing the differences too, because if we're keeping them safe, yes, it's keeping our residents safe, but it's keeping their families safe. So
Yeah.
they've been very cooperative in getting tested. Anybody can call out. There's no punitive action for calling out for sick. Again, that's against the Department of Labor, but we never do that. If you're sick, you don't come to work, especially in what we do. If you hiccup, you don't feel right, don't come in.
Right.
Call us. We'll come up with a way. We'll figure out a way to get you tested. We pay for every internal test. We actually have to let the state know once a week that I, as the administrator, that we offer free testing to every staff member, and then that it's at no cost. And
Okay.
each test that we do is $100. And I
Yeah.
would say that we have probably sent, since the beginning of this outbreak right now, we've probably done easily I don't know, 1,000, 1,200, 1,500 tests. And we'll continue to do them. And it's same for we pay for the ones for the residents too. And it's the surveillance testing is really helping us out. It's helped us out for the past 5 months or 6 months when we were recovered. It's helped out a lot of our sister facilities and a lot of the other nursing homes. That's the only way that we can try to get it or try to keep it out. The downside, I will say though, is when the state did allow us to open to visitors, the visitors that come in don't have to be tested. We can't force them to be tested, and we can't ask them if they've been tested. We screen them, we take their temperatures. Even like the state surveyors, the DPH surveyors that come in our building for infection control surveys, they're not required to be tested, which is kind of a goofy thing from, I guess, our industry. But so it is challenging. But as far as the staff, they've been great. We know that we're here to support them. If they have any needs, you need extra time. I mean, this is our second time around, but a lot of them, they're really good people. And actually, there's a few from Acton. We actually have a family. There's probably 7 or 8 from the same family that live in Acton, and they've been working here over 20 years combined, or 20 years each. And it's just real good people. So we're trying to do our best to keep them safe.
Yeah, the testing has been really the primary control measure, as well as separation into cohorts. And that was the first outbreak in the state of Washington. They identified a lot of asymptomatic transmission. And so that's where the testing comes in. So you're doing a great job.
Thank you, Dr. Bill. I'm just curious, Mr. Foy, last time around, there was an issue where some of your staff were working in more than one congregate living facility. And I believe you were attempting to try to either eliminate or reduce that. Is that still an issue, or has that gone away?
It's kind of become, it's almost like an industry standard now, and we all kind of get it. So it's actually not an issue now for us, and we don't have a ton of, I guess, skilled nursing facilities. I think we have 6 or 7 in our Emerson collaborative around this Route 2 corridor here. Right now, I mean, we did have a great CNA that we shared with Rivercrest prior to the first outbreak we had, and Rivercrest also had an outbreak too. And he decided to stay there full time, and we lost him, and it was kind of a loss to us, but it was the right thing to do. And we, even with our sister facility in Neshoba Valley, even Care One, Westford House, we all kind of know each other, and it just makes sense not to share staff. Yeah, we're always looking for staff, but there's just too much that can go wrong. And even the staff, I think some of our staff members realized that I think some facilities maybe did it a little bit better, or were willing to do a little bit more for them. So I think this time around, we haven't had any issues with anybody. Even our sister facilities, like we have a therapists that sometimes are like travel therapists. They'll go from facility to facility sometimes, and they're all tested. They're all doing the same things. But if anyone has symptoms at that buildings, like they stop moving around. They stop doing things. So the nice part is the people that are really on the one-to-one caregivers, we're not sharing them with other people.
Okay, thank you. Members, questions for either Director York or Mr. Foy? Mr. Conaby.
Yes, thank you, Mr. Foy. Very much appreciate your update and all the work and efforts and to keep all of those residents safe and your staff safe as well. You mentioned you're not really sure what the initial outbreak was from. Did you have visitors or other folks coming into the facility at that time you can trace? And also, were all of the initial cases at the same time, or did you see a little bit of spread amongst the residents in different areas of the building? I mean, maybe you can, because obviously that's something which is concerning, of where you now have an outbreak after all of your hard work to contain it from before.
Yeah, so so the Department of Public Health is our, I guess, our governing body, so to speak, that will set all the regulations based off CMS, Centers for Medicare and Medicaid Services, through the federal government. So they had come up with visitation. There was a long time, I would probably say from April upwards till June, they had suspended all visitation from all visitors into nursing homes. Once I think that summertime came around and we were able to get outside, the weather was nicer, they actually cleared us to do outside visits. And it was very specific. You had to do it outside, social distance. We had to tape off the areas. We had to ask questions and screen people. And then as it got colder outside, as the weather changed, they actually set us to have, I believe it was towards the end of September that we were cleared to have internal visits where we actually have to let the families have visits because it's against their federal resident rights. But there was these safety things with that. It was good, and then the state actually put it in writing that when we changed the memo is that when the visitors came in, the visitors were allowed to hug their loved ones as long as they both wear masks and they turn their faces away from each other. And I could hear, as you guys, I've heard you guys talking, and you guys seem to take the mask thing, as a town, like very seriously. It's great for me to hear that. But even as a caregiver, a family member who could be positive, doesn't have to be tested, could be asymptomatic, can come into the facility and go up and hug their mom. Now, it is less than 15 minutes. It could be a 10-second embrace, an 8-second embrace, but their faces touch each other. And there's nothing that we can do about that. But we're also looking at the psychosocial, emotional well-being of patients, that they're having zero contact, zero interaction. So that's been going on since September. We've done a good job inside, and there's all these cleaning protocols between families. You have to wear a gown, you have to wear your mask. We actually switch masks when you come in. But we tried really hard to do that. So we did have visitors that came in. Our vendors had to be tested. Our hospice companies, the hospice would come in, provide services, they'd have to be tested. Our physicians, our nurse practitioners, we had 2 hospice companies. We have a Jerry Psych services nurse that does mental health well-being. She had to be tested under the same protocols. But the residents still went out to their appointments. So if they had to go back to the hospital and they had to get a CT scan, once they were allowed to, then a chair car, so an ambulance chair car would come and pick up the patient or the resident, take them to the hospital, do a CT scan or do a follow-up and then come back. So residents were still leaving, residents were still coming, family members, and actually the family members can still take them out the facility right now. If I had a family member come today and said, I'm taking my mom out for dinner, there's nothing you can do about it, Chris. And unfortunately, I can't. I have to talk to them. I have to tell them about the risk. I got to tell them about the numbers in the state, where we are, why it would be detrimental to your mother's or to the health of your family member. But if they want, they can take them, and then they bring them back to me. If they do bring them back here, which they do, I have to now put that person on 14-day quarantine. But I have no idea what they did when they left. I don't know how big a group they went in. Sometimes they went out to eat. So there are a lot of challenges with the nursing homes because we definitely have the restrictive atmosphere, but I don't want to say the word prison, but we can't lock the people in and have nobody in and nobody out. We still have to operate to let them go to their appointments and to let some people come in for their social well-being. So it's a very challenging because we just don't know when they leave our doors and they go to the hospital for a small test, is that person negative? The ambulance, if the ambulance guy picks that up, but the night before, that ambulance driver responded to a call in Maynard, and it's a COVID positive patient, and they brought that COVID positive patient to Emerson. They went home and showered. Next day, they're going to come up and pick up my resident. There's a lot of challenging pieces to it, and if you really think about it, kind of make your head kind of go at it. So it is really hard because on the track tracing part of it, as you had mentioned, if you can get that first piece, and I know Heather's probably the expert in the room here on that, but if you can get that first, this person at this time or this incident, and then work backwards, then you can really get a good track tracing on it. Because we are unable to do it, I did have 11 residents on one testing date that we did. They were all on the same unit. And the first three staff members that tested positive, first four staff members that tested positive after they did, were working on the same unit. So in taking that, it was a very kind of specific area of the facility with a specific group of people, and it still remains that today, since November 20th when it started, it's been in that group of residents, and we haven't found it in any of our other residents. And again, like I said, there's a few other staff members that have tested positive, but they're also working on track tracing with their public health nurses to see if there's anything in their community or in their personal lives that maybe they could have got it from.
So the answer is you really are not sure in the contact tracing where the initial outbreak, and it was the large group all at once that was found.
That's the hardest part. That's the hard, because working with the Department of Public Health is we have to come up with a plan of correction of what we can do going forward. And usually when we make a plan of correction, if there was something that we were deficient in or we didn't do correctly, oh, you didn't do this, oh, you didn't do that, all right, let's put a plan together and do it. Because we don't know exactly how, that makes it a little harder, because was it internal? Was it a staff member? Was it a family member? Was it a vendor? Is it when they went out to the hospital, went out to a medical appointment? That's what makes it harder for us, because we just, to find that root cause is challenging in this type of situation.
All right, thanks. I guess we appreciate all your efforts, and hopefully going forward, continued compliance and testing and monitoring and vigilance will help.
Thank you.
Thank you, Mark. Other members, questions, comments? Either Heather or Mr. Foy? All right. Cheryl, do we have any comments, questions from members of the public? Okay.
Bill?
Yes, Mark.
I was going to ask a question of Heather if she wanted to give us a little bit of an update. We've gotten quite an extensive one on life care, but you mentioned some things at Benchmark. Any other group homes, assisted living facilities, or updates on the schools? Did you get
Hi, Mark. The other than Benchmark, I don't have any updates. We do have one daycare that did have a positive child, and the contact tracing is ongoing. And nothing has come in from the school since we talked last week, which is good news.
Indeed. Thank you very much.
Okay. Well, I think Charlotte, yeah, that's right. I did already ask you. In that case, I guess we're ready to move on to the next subject. Charlotte, I believe that actually takes us into our regular business on the agenda. Is that correct?
It does. So the first thing we have on the agenda is 23 Mohawk Drive. So this is a case, I'm going to see if I can pull up the Evans memo. Can you all see that?
Nope.
Can you now?
Yeah. Yes, we can.
It just took a bit. All right, so this is a case where this person hired a Title V inspector. They conducted the inspection. They popped the cover of the D box and looked at the homeowner and said it's failed. So we actually received a call from this person asking us to come out on site, and something we don't normally do, but we did go out with the with the idea that we weren't going to give them any recommendations. But so Evan did go out. He noted that the distribution box was severely rotted. He said he was unable to diagnose whether it could pass or fail without literally putting his hand in there and digging out pieces of concrete and dirt that had gone into this rotted D box. So he said there was also some noted carryover, which he sees a lot when there's no effluent T filter. So he advised the homeowner that, we'd have to have another Title V inspection. So they conducted another Title V inspection. First one was done by ABC Cesspool. Second one was by Curtis, and Curtis conditionally passed the Title V with the replacement of D-Box, which has since been installed, which Evan has also inspected, and he said that they introduced copious amounts of water and nothing came back. So based on these recommendations, we believe that we should accept the second passing Title V report.
Okay. And are you asking for board concurrence on that?
Yes.
Okay. Questions from members? Mr. Conaby.
Yep. Heather, you say that they replaced the D box and it looked like it was taking water. Would you normally recommend that they inspect or camera the lines just to make sure they're not clogged, since it was already indicating that it was clogged and not accepting?
Usually we don't ask them to camera the lines unless it's not accepting the water, but Evan said they submitted quite a bit of water, introduced quite a bit of water into the system, and he didn't see the need for that.
Okay. I guess the other thing is we should make sure, if you are going to accept that report, as the department recommends, that they, put it in the record. So if some subsequent purchaser or homeowner would acquire the property, they would be properly at least informed of the circumstances and the history.
I can do that.
Okay. Cheryl, do you know if this requires a board vote or just a consensus opinion?
I mean, in the past, we've had 3 inspections where we've asked you to pick which ones. We have voted on those. So, I mean, I don't think a vote would hurt unless you're opposed to it. But
No, not necessarily, but I see Ms. Spacetta would like to make a comment. Please go ahead.
Yeah, do you know how old the system is?
this system, I don't have the date in front of me, Joanne. It's 70s, I think. It's fairly old.
And all the other components past Title V?
Correct.
Well, what do you think,
All right.
Joanne? Don't leave us in suspense.
Well, I mean, it's a 40 to 50-year-old system, and obviously it was in failure. But I guess if you guys might know if the stuff, if the equipment is operating even though it's that old, then I guess that's fine. It just seems like it would have been a good opportunity to get a new and better system. But if it's working, then I think it's okay. And along with, I agree with Mark's suggestion of having some sort of record for the next homeowner so they know what they're getting into.
What they're buying, yeah. Okay. So I'd just like to offer one comment. We are down a regular member, and I know a few times in the past we've asked one of the associates to jump in, only to have the missing regular member then join the meeting. So I'm reasonably certain that Rika has been willing to jump in on 2 occasions, but has never actually gotten the opportunity to do that. So I believe it would be Rika's turn to be a voting member tonight. Dr. Jacoby, are you okay with that?
Yeah, that sounds right. I think that's what I remember too.
Okay, so Rika, are you willing to vote on this issue?
Sure.
Okay. Great. Thank you. All right. Well, given that, is there a further discussion among members? Hearing, Dr. Taylor.
No, I was preparing for the vote.
Well, go for it. Please make a motion, then we can have a vote.
I make a motion that we approve the Title V second inspection.
Thank you, Dr. Taylor. Is there a second?
I can second it.
Thank you, Dr. Singh. Motion is made and seconded. I'd ask, I'm just trying to make sure I get my screen aligned here. Ask if there's any comments from members of the public, Cheryl?
No.
Okay. And in that case, members, please vote. All those, well, let's see, I guess I should do this by roll call. Mr. Conaby,
As long as it's noted in the record about the history, aye.
Dr. Singh,
Aye.
Ms. Becerra,
Aye.
Dr. Taylor,
Aye.
and I also vote aye. Motion carries unanimously. Thank you. Well, thank you, Cheryl. I believe beavers are next. Is that correct? Or
Yep, that's correct. So I have 2 requests for emergency beaver trapping permits, one at 989 Main Street and one at 183 Arlington Street. The one at 989 Main Street has been before you before. This issue is currently flooding the driveway, the dumpster, and it's approaching the building. So that's one of the reasons we believe that there is a threat to human health and safety. So we believe that one should be issued. The other one is 183 Arlington Street, and this one is town-owned land that is basically causing flooding on the properties at Houghton Lane. So this one was really bad. I spoke with Bill, and I'd be looking for that one to be issued retroactively. So I have the dates in the last part of this. So we're looking for the one at 989 Main Street to begin on the 1st, and the 183 Arlington on November 24th.
very good. Thank you, Cheryl. Comments from members of the board? Okay. Mr. Martin.
I'm sorry. Go ahead.
Mr. Connolly, go first.
Okay.
My question just were the normal ones. Do they have someone already waiting to do the trapping if they're hired and licensed?
They do.
And the second question, is this trapping or trapping and breaching?
Trapping and breaching.
Okay, thanks.
Mr. Martin.
Yeah, I just wanted to say that the one at 183 Arlington Street is also causing the site of the new twin school not to drain properly because of the high water level. So we've had a lot of rain lately, and it's the brook is backed up to get closer and closer to the school district property.
I suspect it will be worse tomorrow morning based on the weather out the window at the moment. All right, well, very good. Is there Ms. Becerra?
Yeah, I was just going to ask if the activity at the school property was, exacerbating any potential draining issues, but it looks like it's the other way around.
Yeah, we became aware of this problem when the school reached out to us, but unfortunately, the way the regulation's written, there was nothing that was, a threat to health and safety from the school property. So we actually did some tracking back, and we found where the dams were. And but you're right, it's definitely impacting the schools and the residents on Houghton Lane.
Mm-hmm. Thanks.
Okay. Dr. Taylor, did you wish to make a comment?
No, I'm fine.
Did you wish to make a motion, perhaps?
I can make a motion.
All right.
That we confirm their right to have the beavers trapped and removed, as well as breaching the dams in those 2 properties.
Thank you, Dr. Taylor. Is there a second?
I'll second.
Thank you, Ms. Becerra. We have a motion made and seconded. Is there a public comment, Cheryl?
No.
Very good. Since historically the board has been pretty much aligned with, if the physical evidence fits the criteria, we tend to grant the permit. I'm just going to ask for a voice vote. So members, all those in favor, please say aye.
Aye.
And then I'll ask, are there any opposed? Hearing none, I declare the motion passes unanimously. Thank you, Cheryl. I believe we have another variance. Or did
Sorry.
I?
No, I think that's it, just the minutes now.
Oh, very good. Okay.
Yes, we have two sets of minutes, one for November 16th and one for November 23rd.
All right. Well, shall we address the minutes from November 16 first? I read the minutes and, I'm not, there are some things I might have said a little differently, but I think the facts are correct and it reads just fine. So I have no comments. Any other members have comments on the minutes of November 16? No comments? Mr. Conover?
Motion to approve.
Is there a second?
I'll second it.
Thank you, Dr. Taylor. Motion made and seconded. Any further comment from members of the board? Any comments from members of the public?
No.
Very good. Again, I anticipate this being routine, so all those in favor, please say aye.
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 Any opposed? Motion carries unanimously. Thank you. Then next we have the minutes of November 23rd. I actually have some comments on this one. Normally they're minor things, and normally I would just hand them to you, Cheryl, but that's become slightly more difficult lately. I apologize, but on the front page where it mentions the Board of Selectmen members, I was just going to suggest we put chairman after John Benson's name.
Okay.
And then under paragraph 1 in the opening, about the fourth sentence down, it says it was necessary policies and conclusions in, and I believe the word order is missing after in, to help keep our residents safe.
Okay.
And let's see. Oh yes, up in the top, I was just going to mention our associate members, both are doctors. So you might want to just make a note of that. On the second page, it's again picky, but it's the paragraph that begins, Ms. York indicated. Since March, in the very last sentence of that paragraph, it says, be mindful during this holiday season. I think, again, it needs a word in order to do our part. And that's it. Pickiness over. Other than that, I have no comments. Other members, comments?
Nope, they look good to me, other than I didn't catch everything you caught. So, if you want, I can make a motion to accept with the corrections as noted.
That would be very helpful. Thank you, Ms. Becerra. Motion is made. Is there a second?
I'll second it.
Thank you, Dr. Singh. We have a motion made and seconded to accept the minutes of November 23rd with some minor corrections. Any other further comments from members of the board? Members of the public?
There's not.
Members of the selectmen, since Mr. Martin, you were one of the participants.
Nothing for me. Thank you.
Okay, very good. Thank you. All those in favor, please say aye.
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 Any opposed? Motion carries unanimously. Thank you very much. So Cheryl, I believe that brings us to the end of tonight's business. Is there anything else that we should discuss? Next meeting, perhaps?
The next meeting is technically scheduled for December 14th.
What do members think? Do we need an intervening meeting, or do we just, if things start to break bad, we call a meeting? Suggestions? My my bias has always been to schedule a meeting and then cancel it if not needed because of the posting requirements for meetings. But Joanne?
Would be a good idea.
Okay.
I was going to suggest the same thing.
Okay.
Beat me to it.
Hard to hit that button.
All right. So would you pick a Monday and
December 7th is the next meeting. Then, if we need it, I'll schedule it, like I said, and if we don't need it, I'll pop you an email.
all right. Thank you very much. Any other business concerns?
I don't have any.
Nope. Members, if oh, I see Dr. Taylor is already unmuted. I know what that means.
I just wanted to say that I thought it was really nice to have the administrator from Life Care Center of Acton and giving us so many details of what they're doing.
I agree. That was very helpful.
Yes.
But I thought traditionally, Dr. Taylor, you have often been the one to make a motion to adjourn. I thought perhaps that might be what you were.
Well, I can do that as well.
Very good. Is there a second?
Adjourn.
Ms. Becerra?
I second.
Thank you. We have a motion made and seconded. All those in favor of adjourning, please say aye.
Aye.
Bye.
Aye.
I've heard a majority of the members, so we are adjourned. Thank you very much, everyone. Very much appreciate your contributions and support. And I'm afraid with the Thanksgiving holiday just passed, things might start to get very interesting again. And Cheryl already gave us one difficult problem that might be facing at our next meeting. So thank you all again, and please stay healthy.